afternoon for me. It is a pleasure to present my study, a study to assess risk of diabetes in Indian women, men, and children to you in this esteemed conference. Diabetes is commonly found disorder in today's fast-moving world. There has been a rise in diabetes worldwide, and India is no exception. According to the latest figures, India ranks second, the highest population of diabetics in the world. Some of the factors causing diabetes are obesity, a family history of diabetes, age, and physical inactivity. Uncontrolled diabetes can lead to three types of complications we all know: microvascular, macrovascular, and other complications. This study was aimed to identify risk of diabetes in women, men, and children using the Indian Diabetes Risk Score. The Indian Diabetes Risk Score includes assessing age, family history of diabetes, physical activity, and abdominal obesity as the 4 risk factors. This score was developed by Dr. V. Mohan, one of the leading diabetologists in India. Our objectives of the study were to determine the socioeconomic status of subjects, to measure the weight and waist circumference, and to record physical activity as well as the family history of subjects. So it was a cross-sectional study, and we had 750 each of men, women, and children to a total of 2,250 samples. The age group for men and women was 20 to 40 years, and for children was 12 to 16 years. The data collected include general information, age, family history. We did anthropometric measurements, physical activity, education, and socioeconomic status. With all this, we derived the IDRS, the Diabetes Risk Score. The inclusion and exclusion criteria included that those who were already diabetics were excluded, and women with less than 21 years or above 40 years were excluded, and only 12 to 16-year children were included in the study. We used a questionnaire. The detailed purpose of the study was explained to them, and their consent, a formal consent, was obtained. The questionnaire included general information, socioeconomic status, and IDRS risk score. So the Kuppuswamy socioeconomic scale is something which is deriving the socioeconomic status. India is a country which is a developing country, and yet we find that we have the population being so large, we meet all socioeconomic status people. So we included all of them. The education, occupation, and income is what gives us the Kuppuswamy score, the scale, and that's how we assess their socioeconomic status. Anthropometric measurements, we did weight, we did height, and the waist circumference, and we also calculated the BMI. The BMI doesn't really involve in the IDRS, but we did it only to find out about obesity, and so that we know whether the obese are more prone to diabetes. We assess the physical activity levels with type of exercise, frequency, and duration. For assessing this, the WHO questionnaire of physical activity was modified to the Indian scenario, and we used that. So what did Indian Diabetes Risk Score give us? Age, family history, physical activity, and waist circumference. Looking at the details of the score, anybody with the age less than 35 gets a score of 0, and as age is progressing, the score increases. Similarly, abdominal obesity, if it was less than 80 or less than 90, then the score was 0, whereas as it increased, the score also increased. Physical activity, where it was exercise and regular exercise, it was 0. With exercise or strenuous work, not so regular, was 20, and no exercise was 30. A family history, it is known that either parents are diabetic, a child is prone to have diabetes, and if both parents are diabetics, then we know that actually a person may be more prone to diabetes. A total score of less than 30 indicates low risk of diabetes. 30 to 50 puts them at moderate risk, and over 60 indicates a high risk of diabetes. So looking at the results, so when men and women 1500, they were divided into age groups of 21 to 30 and 31 to 40. The mean age was 27 and 30 for men and women. Children were divided into two age groups, 12 to 14 and 14 to 16, with the mean age of 14.8. What we found that out of the men, almost 73% had a family history of diabetes, and 27.1% did not have a family history of diabetes. Men who had a family history, 22% had diabetic mothers, 26% had diabetic fathers, and 9.7% both parents were diabetic. For women, we saw that the family history was there in quarter of the women, where almost 50% had a family history, and also they were at high risk of diabetes. A little less than 20 had a family history of diabetes, and they were at moderate risk. 10% had a diabetic mother, 12.5% had a diabetic father, and 3.1% were with both parents diabetic. In children, now though this age group is one which is not supposed to be showing us much of diabetes, type 2 diabetes is increasing today more than type 1. We see that type 2 diabetes is increasing. So out of 750 children, 13.7 had a family history, though 86% did not have a family history. But those with a positive family history had 1.6% with diabetic mothers, 2.8 with diabetic fathers, 5.7% had diabetic grandmother, and 3.2 had diabetic grandfather. Now, for children, we actually probed to the grandparents, because it may happen that for a 12 to 14-year-old, 12 to 16-year-old children, their parents are still not coming under the detected, even if they are prone to it. Therefore, we tried to probe and see, and we think that if it is coming from grandparents, then to parents may have, and so will it put the children at risk of diabetes. Physical activity is an important factor in maintaining healthy lifestyle and body weight. Hence, physical activity is compared between two age groups. Men, most of the men had a sedentary lifestyle, 98%. And only 2% were involved in moderate activity. Regular exercise was not mentioned by anyone. In the women, in the high risk category, again, almost all women had a sedentary lifestyle, where only 0.5% were involved in moderate physical activity. Here, there was a significant difference between physical activity and IDRS score. This is between the two age groups. Out of the children, 75% had moderate activity and 25% children had sedentary activity. But here we saw differences in girls and boys. 60% of the girls showed moderate activity, but 35.2% did sedentary activity. Whereas boys were more with moderate activity and lesser with sedentary. Also, in the two age groups, children involved in sedentary activity were older in age compared to children involved in moderate activity. So maybe as age increases, children tend to get sedentary. Of course, as age increased, their studies increased, and therefore their more time was spent in studies compared to sports. Today's attractions, children grow older and they spend more time on laptops, mobiles, and any other electronic devices, thus making them physically lesser active. The girls were sedentary and spent less time in moderate and vigorous intensity compared to boys. Indian girls are involved in any socioeconomic strata. We find that girls are always taught household work, household chores, and they also preferred playing more indoor games in the school environment. So girls as a culture itself tend to be more sedentary, whereas boys focused on active sports, which is the reason maybe they are more moderately active. Looking at waist circumference, we know that waist circumference is indicated in abdominal obesity and it increases the risk of developing diabetes. It is also one of the components of our IDRS. In 20 to 30 year age group, the mean waist circumference was 33 in the age group, and in the older age group, it was 34. Older age group had larger waist circumference and were at a higher risk of developing diabetes as compared to younger in the men. For women, more than half had the waist circumference, that is 53.7% had a normal waist circumference, but the rest of them were at high risk as they had higher waist circumference. A positive correlation was observed between IDRS and waist circumference. For children, the IDRS score was significantly and positively correlated with waist circumference, indicating that if waist circumference increased, the children may be more prone to diabetes. Children in this study who had a higher waist circumference and sedentary activity were at a high risk of developing diabetes. Both of these are risk factors for diabetes. Now let's look at IDRS. So we found that IDRS was significantly higher for subjects in the older age groups in men and women. As the risk of diabetes increases with age, the IDRS score may be higher in older people in the study. Also, higher age people tend to become lesser physically active and tend to become obese. With obese, there are changes in insulin secretion. Also, insulin resistance may increase. According to the IDRS score, 8 women were at low risk, 532 women were at moderate risk, and 210 were at high risk of diabetes. Let us look at the picture over here. When we look at men, there were 13.10 who were at low risk, whereas in women, we look at only 1.1 who were at low risk. A moderate risk was there in 75%, whereas a moderate risk was there in 71, almost 71% of the women. In men, 12.10% were at high risk and 28% were at high risk in women. So when we look at men, we find that 74 and 12, that's 86% will be at risk for diabetes, and almost 98% women were at high risk of diabetes. This suggests that in women, we find that when we look at the two age groups, we found that lower age group had fewer risk, whereas higher age group had higher risk. This suggests that high risk increases with age. And we found that there was a significant difference in age group. So more of the lower ones were less risk and more of the higher age were at high risk of diabetes when we saw the IDRS score. Looking at boys and girls. Now this we have compared the boys and girls because in children we have taken 750 boys and girls together, 350 each. Okay. Yeah, so please excuse me for this. There was a significant relations between IDRS score and gender. Why is it happening like this? The risk of developing in girls was higher because of lack of exercise and more abdominal obesity than boys that we have already seen. And let us see the chart over here. So we find that there are 45.6% were at low risk of diabetes, but against that we have 75% boys who are at low risk. We find over 50% of the girls at high risk, whereas only a quarter of the boys were at moderate risk. And there were no boys with a low risk, but there were 0.5% girls at low risk. So when you look at boys and girls, we find that girls tend to be at a higher risk, which itself is reflected in the data of women when 98% are at high risk compared to men who are lesser, around 86%. I'm sorry about this. I think my internet is also fluctuating, and this playing with this band itself is distracting me. So in this study, we found 27.1% men, 28% women at low risk, 48.9% men and 70.9% women at moderate risk, and 9.7% men and 1.1% women at high risk of diabetes. Among children, 45% girls, 75% boys at low risk, 53.9% girls and 24.5% boys at moderate and 0.5 and none of the boys at high risk of diabetes. Between the two genders, females, whether it is girls or women, were at a higher risk of diabetes than men. For all, the score was significantly positively correlated with waist circumference. Sedentary women and men had higher IDRS score compared to their moderately active counterparts, and more girls were sedentary, whereas boys were more moderate. I would like to conclude over here. The present study suggests that IDRS can be used in the local community for diagnosing the risk of diabetes. Identification of children at the risk of diabetes and early treatment could greatly reduce the complications of diabetes. If diabetes is undiagnosed and untreated, it can cause complications such as retinopathy, neuropathy, nephropathy, cardiovascular diseases, etc. In this study, many children were at high and moderate risk of developing diabetes. They need to take care, a proper diet, and be physically active so that they can avoid diabetes in their future. Thank you.